Barbers. Muhammad Aziz, a barber, went to a city hospital OPD to get treatment for painful swellings with pus between his fingers and an oval-shaped area of macerated white skin on the web between and extending onto the sides of other fingers. The doctor in the overcrowded OPD told him it is due to bad hygiene of his hands and gave antibiotics. The doctor should have asked him a simple but important question. What exactly is the nature of your work? He could have diagnosed the conditions called interdigital pilonidal sinus and erosio interdigitalis blastomycetica, caused by short hair piercing the webs and Candida infection. Effective history taking has long been identified as a core discipline in treating patients. Spending more time compiling a good patient history has been known to provide the most benefit as compared to long physical examinations and expensive laboratory tests. Collecting an incomplete history can affect initial therapy and all subsequent decisions for treatment. Therefore, it is essential that primary care physicians ensure that neither the patient nor the health system is unduly burdened by deficient history taking. Primary care providers and family physicians can play an important role in improving the recognition of occupational disease, preventing progressive illness and disability in their own patients, and contributing to the protection of other workers similarly exposed. This role can be maximized if physicians raise their level of suspicion for workplace disease, develop skills in taking occupational histories, and also learn basics of advising prevention. Industry profile. Barbers have been an essential service in India, and in most cases, they are a traditional occupation. The community of barbers is called Nai or Hajam, and in many areas of India, it is recognized as a separate caste, and where it isn't, is a family tradition. Traditionally, the profession has been associated with hair cutting, hairdressing, and shaving male hair. However, in recent times, the occupation also offers services such as facial bleach or beauty treatment, hair dyeing, ear lobe piercing, and head massage. Many hairdressing salons in the cities now offer extended services to women also and are known as unisex salons. Some establishments are also known as beauty salons or beauty parlors. They offer hair cutting services to both males and females and also offer hair removal services such as waxing and threading. They also offer procedures such as manicure, which is a treatment of the hands involving nail and cuticle treatment, and pedicure, which is treatment of the feet, which also involves softening of the skin and removal of calluses. Clubbing all these tasks into a single profession is pertinent, as the same levels of exposure to various chemicals is found, as well as the nature of work that leads to the same postural problems, as well as high-risk interaction with infected areas of the body, making them prone to infections as well as unknowingly aiding in their spread and transmission. The entire gamut of services offered has given the profession a new name: skin care specialists. There are more than 2.3 million barbers in Uttar Pradesh alone. Distribution of workforce. Hair care and barber work in India usually falls into the following categories: family establishments in cities, villages, and towns. These are traditional barber shops offering hair treatment services to men. These establishments are better equipped to control infections and adopt healthy practices. traveling barbers who conduct home visits or visit crematoriums or religious places to perform haircuts or tonsures. They have a barber's bag that contains all their equipment. They have limited resources and cannot use new and disinfected equipment for all their customers, nor can they take care of their own health in the same degree as people in regular shops and establishments. Employment patterns in urban areas are changing, and a large number of women have also taken to the profession. A number of institutes offer cosmetology, beauty treatment, and hairstylist courses, and hair, skin, and beauty treatment is now offered in hotels, spas, and even shopping malls. Organized businesses and franchises have sprung up in cities offering exclusive hair care treatments. They are better equipped but carry some occupational health risks too, especially the exposure to chemicals and postural problems. Characteristics of work. Whatever be the activity, the following are the characteristics of the barber's work. 1. Problems such as constant standing, leading to mechanical load on the joints and vulnerability to varicose veins, poor posture because of having to adjust to different body physiques of customers, and having to strain the eyes and turn the neck constantly may lead to pain and ophthalmological problems, longer working hours, missed meals, not taking breaks during working, as well as being subjected to extremes of temperatures are some of the other hazards that persons in this profession encounter. 2. A variety of chemical products such as shampoos, creams, aftershave lotions, astringents such as alum, hair dyes, antiseptics, bleaches, sprays, herbal products, nail paint removers such as acetone, cleaning agents such as hydrogen peroxide, and hair conditioners. Apart from the aforementioned chemicals, other innumerable toxic ingredients are present in the products which may be used by barbers and beauticians. 3. The work environment submits the barbers to higher electrical and electromagnetic exposure. Higher humidity and glaring lights are other physical influences that these persons constantly encounter. 4. Workers in beauty parlors and hairdressers and barbers' salons are likely to have contact with blood through processes such as cutting, manicure, pedicure, and skin care. Physical injuries coupled with lack of personal hygiene, ignoring the need for decontamination, disinfection and sterilization of working equipment, improper disposal of waste, and unhygienic or absent sanitary conditions contribute to the risks of acquiring and spreading infections to others. Health problems and disease patterns. Barbers' shops are usually hotbeds of infection. In addition to biological materials such as hair, blood, and sweat, there are a number of irritant chemicals as well as allergens that are part of the air in barbers' shops. Customers visiting the barbers' shops are at serious risk of acquiring blood-borne infections such as hepatitis B, hepatitis C, and even HIV. A common problem encountered after a visit to a barber's establishment is the development of folliculitis, known as barber's rash. Also called psychosis barbae, it spreads over the area of facial hair and may even extend to the hair follicles of the neck. Staphylococcus aureus may be the main infective agent. Failure to use clean and fresh towels and razors, absence of proper disposal of waste, especially used plates, hair, solutions and creams, and lackadaisical attitude towards personal health and hygiene puts workers in barbers' establishments at risk of developing or acquiring the following conditions. Health condition and causative source. Dermatological conditions. Irritant contact dermatitis. The degree of damage following irritant exposure depends on the potency of the irritant, the duration of application, the frequency of exposure, occlusion, temperature, anatomical site, and individual susceptibility. Causative source. This condition occurs when the damage to the skin happens due to 1. Repeated exposure to water or sweating inside gloves. 2. Contact with shampoos and other irritant chemicals. 3. Friction from hair shafts, scissors, combs, and other instruments. 4. Drying the skin with use of hair dryers. Allergic contact dermatitis. Symptoms subside after skin is no longer in contact with the allergen. Causative source. Some of the known sources are 1. Nickel in jewelry or metallic objects such as bells. 2. Preservatives in shampoos, conditioners, hand creams, etc. 3. Hair dyes containing paraphenylene diamine. 4. Bleaching agents and disinfectants like hydrogen peroxide and ammonium persulfate. 5. Acid perming solutions containing glyceryl monothioglycolate. 6. Rubber antioxidants or latex allergy. Bacterial infections of the hands. Impetigo, furuncles or folliculitis. Causative source. Staphylococcus aureus or Streptococcus pyogenes infections of wounds sustained during hair cutting. Paronychia. Nail bed infection from Candida albicans. Causative source. Hand dermatitis and wet work also predisposes to yeast infection. Erosio interdigitalis blastomycetica. It is a skin condition caused by a Candida albicans infection characterized by an oval-shaped area of macerated white skin on the web between and extending onto the sides of the fingers. Causative source. Hand dermatitis and wet work also predisposes to infection. Hair shaft injuries. Customers' hair may penetrate exposed areas of the skin, such as nail beds. Causative source. Foreign hair particles sometimes penetrate skin like sharp needles and cause irritation, pain, and infection. Interdigital pilonidal sinus, also called Barbers' disease. Cause. This disease is caused by short hairs that penetrate the interdigital spaces of the hands. Injuries and musculoskeletal conditions. Comb hand injuries. Injuries to the non-dominant hand can be reduced by holding the hair with the index and second fingers of the hand pressed together, one on top of the other. Cause. Scissor and razor wounds on the web between the index and the middle fingers of the non-dominant hand. Thermal burns. Affecting fingers and wrist of the non-dominant hand. Causative source. Improper straightening irons and hair dryers. Pain. Acute neck pain and back pain. Causative source. Standing for long periods and adopting awkward postures to aid in hair cutting for customers of different height or physique. Varicose veins and varicose ulcers. Affecting veins of the legs. Causative source. Standing for long periods. Respiratory conditions. Allergic rhinitis. Additionally, bronchitis, chronic cough. Causative source. Inhalation of substances in the air due to poor ventilation or cleaning or dusting of the premises. Ideal recommendations for health, safety and welfare of barbers and beauticians. Major and minor injuries to both clients and employees can be caused by 1. Slippery floors due to product spills and hair clippings. 2. Burns from dryers and curling irons. 3. Cuts from razors. 4. Repeated exposure to hair products and coloring agents. 5. Apart from injuries caused by typical slips and falls, a chemical can get into barber or client's eyes or mouth, or they suffer an allergic reaction to a product. 6. Because the nature of this work requires physical touching, they also have to guard against the perception of any inappropriate physical contact with clients. Advice to barbers and beauticians. 1. Salon or barber shop should be comfortable, clean and safe. 2. Regularly sweep up hair clippings. 3. Mop up any product spills immediately to limit the chance of slips and falls, and clean and disinfect all equipment that comes in direct contact with customers. 4. Be mindful of the chemicals and ingredients in all the products. Preventive interventions require strategic contribution and efforts from government through occupational health and safety policy and legislation, cooperation from employers as well as workers, and advice from medical professionals. Occupational diseases manifest after long latency period from the time of exposure. There are challenges to establish and declare that a disease is due to hazard at workplace. Elaborate guidelines for management and prevention of occupationally caused diseases is beyond the scope of this documentary, as currently there is no mechanism for doctors to enforce their recommendation without a statutory backing. We therefore give general principles of prevention. Preventive measures should be designed and implemented at 3 levels of prevention. 1. Primary prevention aims to reduce the occurrence of disease by eliminating the cause of disease, for example, use of benzene-free solvents or solvent-free paints to eliminate the risk of carcinogenicity, or reducing exposure to safe levels that prevent it from causing damage, for example, reducing noise at its source to levels that do not cause noise-induced deafness. 2. Secondary prevention to identify and treat health problems as early as possible, often before symptoms have developed, in order to take corrective action. For example, regular audiograms among workers exposed to high levels of noise in the work environment. 3. Tertiary prevention aims to avoid complications of and disability from illnesses and injuries and/or to provide rehabilitative and palliative care. It aims to minimize the consequences in persons who already have disease and depends on appropriate treatment. We expect that the primary care physicians are already well versed with clinical knowledge for management of the occupationally caused health conditions. To learn more about detailed clinical perspective, treatment and prevention and control, please refer to e-book or printed version of BOHS for informal industry, manual for primary care providers. So, if your next patient with any of the presenting symptoms we described earlier comes for treatment, Please don't forget to ask him the million-dollar question. What exactly is the nature of your work?